really hard going last because there's so many amazing presentations I have to follow. Also, I drank all my water, so I had to take Charlotte's water. Hope that's okay. For those of you who haven't met me or who have met me before, my name's Matthew. My project was with Island Health and the Department of Population Health and Epidemiology with the MHOs under Mersha Gully, who you'll be hearing about tomorrow, which is, she'll be doing a lovely talk, as well as Jay DeHia, who's with the Healthy Built Environment Consultant with the EHOs, the Environmental Health Officers, so thank you all for that. So I had two projects that I worked on. One was the environmental scan for climate change, which I'll be focusing a little bit more on, as well as the climate change fact sheet. This fact sheet was more for local governments, whereas the environmental scan was a little bit more for the MHOs who specifically would be using it as a backgrounder for their annual report. So that was very lovely. Just check my notes. So the purpose of this project, particularly the environmental scan, was to look at how climate change is impacting the Island Health Service Area. So the Island Health Service Area is not just Vancouver Island, it's the Gulf Islands, so I'll be kind of referring to it as the islands, but there's a huge sort of swath of land that Island Health has to take over, so it was looking primarily at that. So we all know that climate change has massive impacts on our health. As you can see, the natural environment, built environment, there's a huge amount of impacts that are happening to our health. So what I was trying to do is look at the climate change response. So that's particularly mitigation, adaptation, and resilience. So mitigation is decreasing greenhouse gases. So that's like you're changing to renewable energies. You want to decrease that carbon footprint, et cetera. Whereas adaptation is sort of building infrastructure that will help deal with climate change, where it be like flood levees or strengthening the envelope of housing to deal with rising temperatures, et cetera. Whereas resilience is a little bit different. It's more on how are communities coming back from sort of a disaster or from climate change. How are they sort of springing back after, say, like a flood, et cetera. So that's more like insurance, flood insurance in sort of flood-prone areas. So we all seeing climate change on the island, as you can see. This report was put out by the Pacific Climate Impacts Consortium, which I think is at UVic, PICS. So it looks at a lot of different factors. So this looks at a baseline from 1961 to the 1990s, comparing it to the 2050s. So as you can see, we're looking at a mean temperature rise of plus 1.5 degrees Celsius. We're looking at more precipitation in the winter, as well as less precipitation in the summer. So that has big impacts on sort of island health, and especially with a lot of health impacts in the communities. It's hard to really ignore a lot of the impacts that are happening, especially within the media, because we're so well connected. We had, in 2010, we had a big Russian heat wave, which killed approximately 65,000 people from smog and heat-related deaths, et cetera. We've recently had that, that really bad windstorm I think it was in December, taking out, power everywhere on the island, or sort of in sort of key areas. We're having sort of, in 2018, we had, increased rainfall. We've had warming waters, which contributed to sort of Vibrio cholera on the island. This is particularly in Qualicum Beach with herring eggs. So I'm really careful, and I'm not really good at this. A lot of climate scientists and communications, global warming, is, I don't know how I'm going to put this. Global warming is the cause of this. So it's more of a contributing factor. It's not sort of, you're saying it's causing this. It's that contributing factor that, a lot of the climate communications that I've talked to you with, you have to be very careful when you sort of explain these things, which I'll sort of explain a little bit later. So the methods that I used a SWOT analysis. So if you don't know, strengths, weaknesses, opportunities, threats. Because there was so much information, I chose this method just sort of to put it all together. I did a lot of sort of peer review information, but the challenge was that climate change is happening so quickly that I did have to go into gray literature as well. So we did look at a bunch of gray literature, trying to really sort of get a better picture of what's actually going on. So some interesting findings. So we looked at a number of regional growth strategies as well as official community plans, just sort of to find what is the level of planning that's actually going on Vancouver Island. So taking this planning is actually pretty important because it gives us sort of an idea of what's actually going on in the community, especially from a planning level, because adaptation, as you know, adaptation, mitigation, and resilience will probably come from some of these documents. So what did we find out here? So we found a lot of OCPs, and we looked at about 60 of them. They a lot of them had sort of the mitigation. So that's like, we're switching to renewable energies. We're doing a lot of, maybe we're going to get some electric cars or something like that. A lot less had adaptation and resilience. So that sort of gives us a really good indication of, there is a bunch of work that can be done towards that sort of aspect of it. So some more interesting findings. So we looked a lot at sort of what the impacts were on climate change and our health. So obviously we're island health, so it's pretty important. I think the really important part of looking at these was to find some local examples of how climate change was actually impacting the health and well-being of people on the island. As you can see, we look at air pollution, vectors, water quality, et cetera, et cetera. So we did, there are impacts on the island already. As I said before, there's the Vibrio cholera. We're having heat events, we're having floods, air quality, changes, et cetera. So, why was this important to us? So it's always just good to put sort of a local, finding examples of how climate change is actually affecting our community. So that's why we had a look at these. So misinformation was also a pretty big topic that I had to look into. As we are becoming more and more connected, we're seeing more and more examples of this fake news, this misinformation, I think particularly perpetuated by the fact that social media and we're just being connected online on sort of a global level. And that's why there's just this, this big resurgence of misinformation, especially around climate change. So this was published in a recent Guardian article on the 22nd of March. It sort of shows this is particularly in the US, it sort of looks at the amount of money these companies are spending on sort of lobbying against sort of climate change. Now, this was really important to highlight, especially in my document particularly because a lot of public opinion would probably, sway a lot of these adaptation, mitigation, and resilience policies that governments are creating. So it's good just to get an idea, this is what's happening out there. So the Indigenous impacts, a lot of Indigenous communities around Vancouver Island, they particularly rely on the natural environment for food sources, for traditional routes. Their livelihood is centered quite heavily around the natural environment. So this is just sort of an example of the changing environments that are happening. This is the Muirs Glacier in Alaska. So taken on the same day, August 13th, but on different times. So this just demonstrates there's sort of this change in the environment which will greatly affect these different communities. So climate change and the islands. Island health has a big role to play. I think particularly more in a supporting role for climate change. This particular here looks at sort of surveillance networks that island health could deploy, or they have the ability to potentially utilize these surveillance systems, but it's quite complex. This was from a literature view which looks at 3 different categories of surveillance systems. So it's very complex, but there is the ability to sort of create these networks and sort of to work together in sort of an intersectoral way because at the end of the day, this is a multifaceted problem, so we've got to take it with a sort of a multifaceted approach. So the challenges are, climate change is happening now. We have to rely quite a bit on grade literature because climate change is happening so quickly. Misinformation, especially in grade literature, is quite prevalent, so I think that's the biggest challenge is to sort of work around that. Climate change is huge, so it's a massive scope. So I think the challenge of this study was really sort of bringing it into sort of a digestible amount of information, especially for 20 pages. And lastly, it's sort of a personal anecdote, working in an office was extremely hard. I came from a high-paced environment, and sort of sitting and doing this work was actually a real challenge. So, yeah. Thank you guys again.
Wonderful. Thank you, Matthew. I can see their hands up already.
Thanks for your presentation. I have a question about something you mentioned earlier about being super careful about your language around causation versus contributing factors for climate change. Can you just elaborate a little bit on that and what that meant and maybe who that bothers potentially?
I think particularly around misinformation and a lot of lobbying against climate change. Climate change is not an exact science at the moment. I mean, the problem is that I think a lot of bodies that are sort of targeting climate change, it's not a thing, et cetera, I think they take a lot of the examples, say, hey, you were wrong at this time. What does that make you right at this time, right? So a lot of them are actually extremely careful saying, it's not the cause of it, it's just a contributing factor, just so they don't get, because it's not an exact science, that's kind of what they got to do.
Yeah, okay. Other comments or questions? No, we're winding down for lunch. If not, then thank you, Matthew. It's such a fascinating topic. Yep.